Oh wait, I think I have it.
Oh yeah, I see your screen.
Never mind, I got it.
All right.
Let's see here. All right. Well, let me know if you have any questions, and then feel free to stop me as we go.
Okay.
Let's see here. I will be sending HR a separate deck of slides that will show you how to do certain things, and I'll mention it. I'll mention it through this deck as we go.
Okay.
Um, right. Let's see. All right, so let me move you. There you go. Alrighty. So Whitman-Walker Health has adopted a language access policy to ensure that the organization complies with Title VI of Civil Rights Act of 1964, the non-discrimination provision in the Affordable Care Act, and the District of Columbia Language Access Act of 2004. So in other words, we're mandated to provide interpreter services to clients and patients. Right. So during this deck, you'll hear me say LEP, which means it's a limited English proficient. That describes someone who's unable to speak, read, write, or understand the English language at a level that permits him, her, or them to interact effectively with health and social service agencies and providers. This also includes a deaf or hard of hearing community. Okay. So when do we identify the needs? Usually we identify the needs when we're creating accounts for the patients or for clients. And the reason why I say patients and I say clients is because there are some services that don't require for anyone to establish care or medical care with us. So in that case, then they'll just be considered clients, and like public benefits and legal is an example of that. So just in case. If a patient's language is unknown, use the I Speak cards at the front desk, which is located at Liz, 1525 or Max Robinson, to identify the patient's language. Um, these I Speak cards, they are a legal document, a legal size laminated document that has just about every language and it says it in their language I speak, and it's so that they can point to what language that they speak, so that way the person that needs to communicate with them is able to then get an interpreter on the phone and let them know what language they need to provide from an interpreter to provide that service to the patient or to the client.
Oh, perfect. Okay.
Mhm. LEP's patient needs should be updated if, for example, the patient becomes proficient in English. So we have patients or clients that have been with us for many years. So at one point they needed interpreter services, and then as time has gone by, they have learned English and they feel confident and comfortable not needing an interpreter. So then what we do is we just update the EMR indicating that no interpreter is needed. The reason why we don't delete the original notification that was on the account is because um, sometimes it can be considered as maybe a mistake was made and the alert was never added to the account. So it just makes it easier just to avoid that and just modify what was there.
Yeah. Okay.
So who's responsible for determining language access needs? Primarily intake staff. Also any Whitman-Walker staff who creates a new patient account and is called upon selecting the patient's language. So client services is is one of the main departments that is considered as intake staff. We also have, let's say, public benefits. We have legal. Um, Let me see here, youth services. So there are quite a few other departments that have an initial um, you know um, they interact initially with the patient. So if they create that account, then it would fall on them to indicate that the patient needs an interpreter, or the client needs an interpreter. So that way, anyone else who later on were to interact, then they will already be a step ahead and make sure that there is an interpreter on hand, via phone line or iPads. We have iPads in every floor and location as well. If the patient does not speak English, staff should ask for more information. If the patient speaks Spanish or Amharic, call upon a bilingual client service representative if available. You can also use Whitman-Walker's interpreter phone line to determine the patient's needs. We'll go over that a little bit too. Okay. Who to identify if there is an error? Any staff can be aware of the course of service delivery that the patient's language are not reflected correctly. Anyone can notify me, and I can make the updates as needed. It can be sent to me in a telephone encounter or an email with the patient's account number. Let's see here. Preferably it's a telephone encounter, but of course we do have some departments that don't really interact with ECW as much. So I want to say external affairs might fall into that category, even though there's access, but email is totally fine. You can just put the account number in there, and and I'll go in there and I can modify it. But like an example would have been, it wouldn't be so much like an error, it's just more of an update. Like I mentioned before in the previous slide, that a patient maybe at one point needed an interpreter, and then time went by and there was no need for one, so that it's just making that update in the account. All right, so family and friends. So advise all LEP patients that they are entitled to have a professional interpreter rather than using their family members or friends as their interpreter. Interpreters go through intensive training on how to properly interpret. Fluency in a language does not prepare an individual to interpret. Also, professional interpreters are bound by ethics and confidentiality requirements that family members and friends are not bound by. Many Whitman-Walker appointment concern serious, highly sensitive matters. The organization and or individual provider could be held liable if the information is not properly interpreted. So it's usually more like a culture thing where there'll be, the LEPs have a preference for a family or friend, or even a minor, like a child, where their child or younger sibling or so may, serve as an interpreter. But our goal is to let the patients or clients know that it is best for them to use a professional interpreter, especially because a family or friend, they're not bound by ethics or confidentiality. So what's to say later on they were to then later on have a conversation with someone they are close to, and then speak of these highly sensitive matters that they provided interpreting services to. But they do have the option if they decide, yes, I completely understand, but I would still like my family member or my friend to interpret, then we think that can, then it's okay. They will have to sign a waiver. We would have to have it scanned into the patient's account. But definitely if it's a minor, we cannot allow a minor to interpret. So we would definitely have to have the patient either reschedule the appointment, or really let them know that we prefer that the language line be used. Any questions so far?
No, this is very thorough.
Okay.
Yeah, this is perfect.
Okay. If the patient refuses professional interpretation, the patient is required to sign a waiver releasing Whitman-Walker from liability of inaccurate interpretation. The waiver form must be scanned into the EMR patient's documents. Change the notes of the interpreter alert to state the date that the waiver was signed. Waiver can be withdrawn by patient at any time. Advise the patient that we will need to reschedule the appointment if their personal interpreter does not arrive for the appointment, unless patient is willing to use phone line. So and I know it says here patient, but the same thing, patient, client. If they signed the waiver, but let's say they came into a visit and this time around they came alone. If they would like to move forward with the appointment and use one professional interpreter, then there is no need to reschedule. It would be great to just go ahead and move forward and use the interpreter line and provide services to the patient. Let's see here. And this is what the waiver looks like. So we have this waiver in Spanish, Amharic, and French. And this waiver is for foreign languages, as well as it also applies for anyone that is ASL, or sign language. So the top portion of the waiver is for foreign language, and then the bottom is for our ASL. Let's see here. So what interpretation is available in person? So currently at this time, the in-person interpretation, it's on pause, it's virtual only. We're currently using Zoom Health. Um, but when we were providing services online and La Clínica del Pueblo, they're currently in the process of, actually, no, they've already started providing interpreter services in person. We're just in the process of going in that direction and allowing interpreters to come on site. As of today, we have not scheduled an interpreter on site since the pandemic happened started last year, but we're about to go in that direction. So. La Clínica del Pueblo, we use La Clínica del Pueblo for interpreter services for foreign and sign language, mainly for patients that have an MCO. So usually the interpreter services that they provide is usually a medical, medically related type of interpretation. So they are the MCOs like DC mainly it's a Mayor Health, MedStar, and Care First Community Plan, which used to be trusted. Um, let's see here, and they also receive Ryan White funding. So if anyone is falls, they qualify for Ryan White, like they're HIV positive, DC residents, and uninsured, have Medicare, low income, then let's see here, then they would qualify for Ryan White. And we can use the Clinica to order those interpreters. Right now, what we're doing is I'll schedule a Zoom meeting uh, with Zoom Health, and then I share that link on their order form, and then they join the provider and the patient in Zoom Health for the appointment. La Clínica, they are also providing in-person interpreters for off-site specialty. So we have like a referrals department, and the providers, they will send referrals to the referral coordinators. The referral coordinators are assisting patients with scheduling. Well, for now, because of the pandemic, they're having some, delays in scheduling. But for those that they are able to assist, and that location has indicated that they do not provide interpreter services for patients, then we want to make sure that at least our patients have interpreter services. So the referral coordinator will also schedule an interpreter to accompany the patient off-site for that appointment. And what's so great about La Clínica, that what they're starting to do is they are helping the patient schedule the next follow-up appointment. So that way, at least there'll always be an interpreter available for those specialty appointments until they no longer need to have those services for that specialty. Um, so that's been very helpful, at least for referral coordinators, because it has been very difficult for them to try to get through like the hospital and so on. So it's been very helpful with patients, especially patients who can't call themselves to the hospital because their LEP, the limited English proficient. So it's been pretty helpful. Let's see here. All right. So um, let's see here. When I'm trying to make sure I don't throw it off here, but when before the pandemic, and still now, when we had patients that needed, like, let's say, an acute appointment or same day visit, regardless to whichever department, such as public benefits, legal, or research, or so on. And so, there wasn't enough time to order an interpreter. So that's when we use the phone line. And Pacific Interpreters is the company that we use for that. They are also the same company that provide us services with the iPads. And we have the iPads at every site, and at 1525 on just about every floor. Um, let's see here. And for ASL, we also use the Deaf Access Solution. They're also an in-person interpreter for ASL. As of right now, we're only using Sign USA for ASL services, but hopefully as things start, um, things are beginning to normalize a lot better, as you know, since it's been about a year or so. So we're going to try to start expanding the companies that we use for language access, so that we can definitely be sure that there's always an interpreter available for just about every service that there is that Whitman-Walker offers. So anyone, it doesn't even have to be medical services. Like La Clínica del Pueblo is the only company that would, you know, that as if it's medically related, we would need to use them if the patient has an MCO, a DC Medicaid MCO. Other than that, we can use Pacific Interpreters, Deaf Access Solution. I'm going to move into the next slide here. Sign USA, ASLI, and Ayuda. Whitman-Walker pays for these services, well, except for Ayuda, but Whitman-Walker pays for these services. So if there's any patient that does not qualify for La Clínica del Pueblo because they do not have a DC Medicaid MCO and they require an interpreter, then Whitman-Walker would pay for that. And the patients will never pay out of pocket to have interpreter services. The reason why I excluded Ayuda actually receives their own grants for interpreter services. Before we were using them for in-person, but they definitely have expanded, the way how they provide services. So, but mainly when we use Ayuda, it's really for anyone who has been, who's been a victim of, let's say, domestic violence or anything that would put them in the category of as a victim. And so they, any kind of like trauma. So at Whitman-Walker, mainly, like, let's say, our legal services, behavioral health, we have a service called DC Sane. And it's, anyone who's, again, been part of domestic violence and they need to come to Whitman-Walker for PEP or PrEP services. Due to that, then they would fall under the category of receiving interpreter services for Ayuda, with Ayuda, if as long as they fell into that category. Okay. So for providers, it is important for providers to notate in the patient's file if they use an interpreter service. So when an interpreter is ordered, right now I'm the only one that is ordering interpreters because we have to take that additional step of ordering an interpreter, scheduling an appointment with Zoom Health to then share that link with the interpreter companies. So, but let's see here. I will put in the reference number in the Zoom link in the appointment encounter. But it is really important for a provider to notate in the progress notes that it was used. So it will pretty much, just support the reference number that was in the appointment, that is in the appointments encounter, where the provider is basically confirming, yes, it was used, especially if patient kept the appointment. But this is only required for providers, but it is helpful for just about anyone who has used interpreter service to document in the patient's file if that was the case, just to show that it was used. To make sure that Whitman-Walker is showing that we're, that we're following, let's see here, that we're definitely, making sure that we are ordering interpreters for LEP patients or clients. So who can order interpreters? Anyone can. Like I said, the only additional step that we're doing is scheduling Zoom Health appointment and then sharing that link. But in reality, anybody can. I have a slide deck for that as well. But mainly, a lot of our departments are using using the phone line, which pretty much is like a three-way. So it can work two ways. We can, call the patient or the client first and then call the interpreter, or call the interpreter first, let them know what language we need, give the interpreter the number, and then they will dial and they will pretty much conduct a three-way call for you. So any staff member who schedules the patient's appointment is responsible for making sure that interpreter is ordered if needed. And like I mentioned before, referral coordinators place the orders for referrals. Let's see here. if assistance is needed, then I can always, TE, telephone encounter can always go my way, or even an email, and then I'll be happy to assist with scheduling that. Right now, because I am the only one that is ordering interpreters, then especially for medical services, then a telephone encounter can come my way, and I'll be happy to order the interpreter and schedule the Zoom health link, and then I'll send the telephone encounter back just to close the loop to indicate, hey, the interpreter was ordered, so we should be good to go for that visit. And then what happens is I also share the link with the patient, so that way they know to join in on that Zoom link versus the appointment encounter that goes out in the EMR. Mm-hmm. And this is for in-person appointments. This is also for televisits, audio. So regardless, anyway, how we have any kind of visit set up, we have a way how to provide interpreters for patients, for clients. Whitman-Walker has a list of positions for which bilingual skills are required: public benefits, designated client service reps, community health, and specific legal services, medical and behavioral health service positions. Bilingual staff members are tested to ensure that they're proficient in English and at least one other language in which they use specialized vocabulary, and effectively, accurately, and impartially communicate in the primary language of the LEP individual. Individuals hired into these positions receive a pay bump. Any questions so far before I move into this next step or topic?
I don't know if we'll get into that part yet, but in regards to digital content, which is what I'm going to be doing, do we use those same resources, or is that something different altogether?
Sorry, say that again.
Sorry, if for digital content and things like that, do we order? I mean, like, how does that work in regards to making sure that there's available translation to everybody, like on the website, social media, or is that something we don't do yet?
Yeah, so right now I work with Jewel closely when it comes to media that's on the website. If it's something very short and simple, then I can definitely assist with translating that. If there is if there's a document that's more, that has more deeper content, we do have someone that translates documents for us. And so we'll send that over to him, and then he'll say, it's been pretty good. There's been about a good 24. Very, very rare has it really been like a 48-hour turnaround, but and pretty much he's more like donating his time to us by doing that. So I'm trying to think anything else that's I want to say another instance would be if a patient, sends out anything through social media, and let's say it's in Spanish, right? And we're trying to provide a response in Spanish. Then that would be translated. Julie will reach out for it, to make sure it makes sense, and then sends it out that way in response to the patient. But usually she's always tries for it to be very general, and just kind of stick to certain template responses when those things happen. Let's see, I'm trying to think of like other examples to give.
No, those are actually perfect.
Okay.
I was wondering if do we I don't want to rely on Google for too much because sometimes it doesn't
I
work.
know. I know. It's I completely understand. A lot of there are people that will they have their verbiage of what they need in English, and then they will use Google to translate, and then they'll forward it over to me. Like, hey, can you double check this real quick? And there are times lately they've been a lot better. But there are times where it's like, what do you say? So I
Every
do
time
need
I
the
send
English
something to my
piece.
friend, he's like, "No, what is this? This doesn't even make sense." So I'm like, "Okay, I'm sorry."
Yeah, it's so it is helpful. I always get the English, and then I'll do the Spanish, or if there's not like a Spanish attempt there. So but yeah, what usually the English is what helps me really understand. Like, okay, I see what you're trying to say, and I'll just shift some words around so it can really make sense. Um, Yeah, I'm not sure if there's ever really been a time that external affairs has needed to use interpreter services, But for, I would say if there ever was, then it would really just be the language line. Um, and so, let's see here. So now that, once we're done with the language access training, HR will provide behind your badge. They'll put like a sticker that has the language access information, which is pretty much the phone number that you would be using for the language line, and that access code, which is the number that we would give them. So that way they can bill us for that service.
Okay. Okay.
Mm-hmm. Yeah, and it's pretty quick. I haven't really received too much feedback in regards to, there being a long wait time for language access, unless it's a language that is not that common. So our main population is Spanish, Amharic, French. We do have some Mandarin, Russian, but there hasn't really been much of any delays with that. But our highest percentage is Spanish, and
Yep.
no delays with getting interpreters on the line for those languages.
Thank you for that, by the way.
Yeah, no problem, no problem. That's the reason why I ask usually, what department, because I try to just make it very relatable. I know that this slide deck is more on the medical and other client service side, but let me see here. But in this piece here will fall a little bit more in your area.
Okay.
Well, let's see here. So of course, Whitman-Walker, we have bilingual staff. And so for bilingual staff, they don't, they are mainly, it's mainly to be able to provide services to patients that, their LEP patients or clients that speak their same language and are needing services for the area that they work in. So an example of that would be, let's say a medical assistant speaks Spanish, and let's say the patient also speaks Spanish. So that medical assistant who has already been tested and is deemed bilingual, and is listed on our Whitman-Walker's organization list as being bilingual, can communicate with the patient in that language. But let's say if we have a bilingual staff who has not been tested, so therefore has not been deemed bilingual with the organization, but knows a little bit of Spanish, and that employee cannot speak with the patient in that LEP language. They will actually need to use the phone line. So that piece there is really important. We do have staff that are bilingual, but the position that they applied for was not a bilingual position. But they volunteer to be tested so that they can be listed on the bilingual list for the organization to be able to speak in that language. So let's see here. And then for this test, Whitman-Walker covers the cost. It's human resources, they do the test for new hires, and then I conduct the test for anyone who's already an employee and later on says, you know what, I want to get tested. I think it's a lot easier for me to just speak my language to someone that speaks my language versus having to get an interpreter for a language that I, of course, already know.
Yeah.
So if they volunteer their time, unfortunately, they wouldn't receive the pay increase because they understand that they'll be volunteering it. But those who apply for a position that is bilingual, that pay is already included in that job description.
Right.
Mm-hmm. Let's see here. So staff members who have not been determined by testing to be bilingual qualified are not permitted to act as bilingual staff members. Section 1557 of the ACA prohibits employees who have not been deemed qualified bilingual to communicate with an LEP patient in the LEP patient's language of origin. Okay to say hello, other niceties, but avoid anything substantive. So let's say if you do interact with a client that speaks a language, and then it would be best to use the interpreter line. Or if there is someone in your department that speaks the same language, then that person can step in in place of you, and then provide, provide the services. So in other words, it would be more of like, I'm going to introduce you to so and so, and then it'll be more like, hi, so and so, this person is looking for this and this service, and if you could please, assist in regards to that. And then you are pretty much removing yourself from the conversation, because you staying would pretty much, it would end up, it would end up being like a three-way conversation, because that third person that then joins would then feel the need to kind of explain to you what they're saying, just because they're not speaking the same language you are.
Yeah.
Yeah. So that's the best example in reality, where a bilingual employee can step in, as long as it's that bilingual employee is the same, does the same thing you do. So in other words, you wouldn't be able to call upon a medical assistant to help let the patient know, or the client know, how what you need to, to help. Because the medical assistant wouldn't be familiar with what it is that you do. So the medical assistant would need you to stay around, so that way they can pretty much, be able to have the correct and give the accurate responses. But then in that case, then the medical assistant will be serving as an interpreter, because now there's a three-way conversation there. So, and that's what we don't want to do. Did that make sense? I'm sorry.
Yeah. No, that's perfect.
Okay. All right. So qualified interpreter. So right now, Whitman-Walker does not have any employees that are serving as interpreters. So we are only using outside organizations to provide interpreter services. So here's an example, same one I guess I tried to give. A medical assistant who is deemed to be qualified bilingual is not a qualified interpreter and should not be asked to act as an interpreter for a provider who is not qualified bilingual. So in other words, like a provider can't call an MA to come in and tell the patient what they need to tell the patient, because they're not serving as an interpreter. Being a bilingual, being deemed bilingual doesn't make them an interpreter. And I think that's what's caused some confusion here and there. So that's why we kind of repeat it in these last few slides here. So when is a qualified interpreter required? So the requirement for a qualified interpreter comes into play when a staff member, such as an MD, a PA, nurse practitioner, dentist, behavioral health provider, community health worker, lawyer, public benefits representative, who has not been deemed bilingual in an LEP patient's client's language of origin, interacts with the patient/client. Here. Let's see, so I'll move on to the next slide. I pretty much summarized just about all of these slides here. Let's see here, same thing, where, like I said, a provider. So Dr. Lane can speak LEP to Spanish-speaking patients without a qualified interpreter present, assuming she is deemed bilingual qualified. But a provider who is not qualified bilingual in Spanish must use a qualified interpreter. Okay. Here. In the recording interpretation, like I mentioned earlier, every provider communicates with LEP, has VA professional interpreters should document the presence of the interpreter in the progress notes. And I do want to say this piece here, I mentioned it earlier, but in regards to the providers documenting it, but it is very important, just because when we have to, gather data for audits, then this information here is what I'm looking for in order to then document that a patient's account received interpreter services all around. So it was ordered, and then the provider had included in the progress notes that an interpreter was used. So now here I have a perfect example of a patient or a client who used interpreter services. So we'll have, during the audits, we'll have different examples of different companies that we have where they want us to list where services were used. So this is really important here for us. Qualified translator. So this answers the question you had earlier. So Whitman-Walker's vital documents are required to be translated. So these are documents that affect access to retention in or termination or exclusion from Whitman-Walker's program services or benefits. So an example of that is like an informed consent. Bilingual staff members and qualified interpreters are not necessarily qualified translators. A qualified translator is someone who translates effectively, accurately, impartially, and complies with applicable ethics principles and is proficient in English and at least one other language, including special terminology. So that's the reason why I wouldn't be able to translate any documents. That is very vital because of the terminology that's used there. For that, it would be best to just use a professional interpreter. For something very simple that we can put on our website, or let's say any verbiage that we're trying to communicate to a patient, then I can definitely assist with that.
Okay. And plus, you have other 1,000 things going on too that you don't want to add to.
Oh yeah, like I mentioned earlier, all these other hats. Yep, definitely.
Yeah.
Yeah. So, and then this is just more of a slide, just indicating what are the consequences of failure to comply, which is Whitman-Walker is required to notify patients about their language assistance rights and inform patients that they can file a complaint with HHS. HHS can investigate complaints. Failure to comply puts Whitman-Walker in jeopardy of losing federal funding. Patients can file claims against Whitman-Walker for damages. Failure to comply will damage Whitman-Walker's reputation in the community and undermine trust between providers and patients, which is why it's so important for us to make sure that we are using the waiver and, explaining all of that to the patients. And that's pretty much it.